Namaskar. Welcome to another episode of Dhai Akhar. Dhai Akhar Voice is an initiative of Dhai Akhar where we will focus on various topics like social issues, mental health, and other areas which may need attention. In today's episode, we will be focusing on the mental health of children during this pandemic. We are very fortunate to have Dr. Teesta Soman, who is a pediatric neurologist at the Hospital for Sick Children in Toronto. Dr. Soman specializes in movement disorders. She has authored multiple scientific research papers and book chapters. In addition to her academic accomplishments, Dr. Soman has worked in the pharmaceutical industry and has represented Grand Challenges and the Every Woman, Every Child Innovation Marketplace at events at the UN Annual General Assembly as well as the WHO. Currently, she is also an instructor at the Faculty of Medical Sciences, University of Toronto for Global Health Initiative in Education program. Please welcome Dr. Soman. Welcome, Dr. Soman. How are you doing today?
I'm very good. Thank you, Manoshi. And thank you for the invitation to speak about this very important topic today.
You have been practicing medicine and working with children for at SickKids for almost 2 decades now. But this is a very unique situation. So, do you think that health problems in children have aggravated during this pandemic?
That's a really great question, Manoshi. And from my experience in my practice, as well as what we have seen in the Hospital for Sick Children, definitely there has been an aggravation in health problems in children during the pandemic, both physical and mental. But the mental problems have shown a real increase and is very concerning to all of us. There has been research in Europe, South America, USA, but also from Canada and the Hospital of Sick Children that has shown that mental disorders in children have been aggravated. Once research that was led by Dr. Daphne Korzak at SickKids interviewed 1,000 parents of children between the ages of 2 and 18, and also interviewed adolescent youth between the ages of 10 and 18. About 350 youth were interviewed. And it has shown that by and large, children have fared worse during this pandemic.
Dr. Soman, so which of these mental health issues do you think have aggravated the most? Which some of them are there a few common mental health issues that have shown up during this time?
Absolutely. There are some that have surfaced more. And one of the biggest one is anxiety. Anxiety, irritability, lack of attention span in children have been some of the common ones. Some of the children have also experienced depression, and there has also been an increase in tic disorders. Now, what has happened is with increase in anxiety, that then increases the incidence of some other conditions. It can make the children more frustrated, and those who have tics, the tics have gotten worse. Anxiety has also increased other physical and health conditions as well. So we've seen a wide variety of conditions in children that have gotten exacerbated, especially mental health conditions during this pandemic.
So, from a layman's perspective, how would you describe anxiety disorder?
Anxiety disorder is, it's defined as the fear or worry of something. So it's natural for all of us to be anxious about something, to worry, to have some fears. But this becomes a disorder when that worry is constant in your mind. That fear never goes away and it's there in your subconscious, even if you're not aware of it consciously. And that's how we define an anxiety disorder. Now, there are some subtypes of anxiety disorder. So there is the generalized anxiety disorder, which is, constantly there all the time. There is also the panic disorder and panic attacks, which are intermittent and you don't experience all the time, but there are some times when you suddenly get the panic attack. There is also a separation anxiety, which is a special situation where the child doesn't want to be separated from what he or she sees as the comfort person. And this can become quite pathologic when the child, will not do anything on their own, and that's the separation anxiety. There is also a social anxiety where people are fearful of being with other people or in social conditions. And then there are some kinds of phobias which are specific, like agoraphobia, fear of open spaces, or fear of spiders. One can have a phobia which is an, an irrational fear, I would describe it as, and that's called the phobia. So there are many kinds of anxieties.
During this pandemic, what are some of the factors that have aggravated this anxiety in children, especially?
Yes, there are actually quite a lot of factors that have come up uniquely in this pandemic situation. If we think of it, there are some that are, more obvious than others. So, a loss of parental income or unemployment causes stress in the family. Then not being able to see your grandparents, or and maybe bereavement, somebody in the family has passed away from COVID, are some of the sort of big factors. But there are other factors which have come up in this COVID situation, such as loss of peer support, because the children are not able to go to school in the way they did pre-pandemic. There's loss of extracurricular activities, which causes a loss of routine for the children. There's also the parents' mental health, because when we are talking about children's mental health in this interview, we have to remember that this is across all ages that people have had anxiety, depression, and other issues. And that then affects the child negatively. The other one of the other big issues is there has been a rise in domestic violence, and even if the child is not the one that is being maltreated, it still has an impact on the child. So these are some of the factors, but really, the most subtle sort of factor has been this loss of routine and a loss of predictability and the uncertainty that has been prevailing for the past year. So it's like it's a chronic stress situation for both for the parents as well as children, and this unpredictability really leads to a lot of stress and mental illness.
Uh, so, Dr. Soman, how are these anxiety disorders? How can parents or we can recognize them in children? How is it manifested?
Yes, it's really important to recognize that your child is suffering, and sometimes the children will not be able to express it and give words to their fears. But some of the common symptoms we have seen is the child gets more easily frustrated or irritable. Um, they can start having some panic attacks, like some breathing difficulties or rapid heart rate increases. We also have noticed that sometimes the children can have physical symptoms that are medically unexplained. So, for example, the child suddenly starts having a stomach problem or a tummy ache or headaches. And these could be also signs of the child suffering from anxiety. Children with tics, for example, their tics get aggravated a lot, also because of this underlying anxiety.
Dr. Soman, we are seeing that during these times, during these very hard times, parents are also having quite a bit of struggle with their jobs, maybe at home, with children being at home learning online. So it is not very easy for them either to manage this situation. So, what would be your advice for parents uh, if they see that their child is suffering from anxiety? So, how can they manage it? What would be some strategies that you will suggest to the parents?
I think one of the biggest things is to actually recognize the problem and to be aware. So I think this discussion we've had will hopefully help parents become more aware of this situation. And awareness is the first step to resolution. Once the parent can be a little more aware, they can maybe have a discussion with their child and ask them. And some children are able to actually articulate what their fears are, depending on the age, depending on the maturity. And then there are others who may not be, and they'll be acting out, or just being having more rage issues or frustration. So I think the first step might be to have a discussion with your child to see what is it that is bothering them, and to not dismiss their fears. So the approach should not be, oh, don't worry, everything will be okay. It should be to accept that, yes, these are concerns, and perhaps the parents have similar concerns, and how can we then solve these together? So that is possible in some children. It may not be possible in your child to have that discussion. The other factor is that one of the things I mentioned earlier was that it is the unpredictability and uncertainty of the situation that is causing the most stress in everybody's lives. And while we cannot control what's going on outside in the environment, what we can control is our own lives to some extent, and our own routines. So having a routine, getting back to the basics, is the most important thing for children. So whether they are doing school online, or they're actually going to school, the children who've actually been able to go to school have had a better routine, but they've also had higher risk, which also causes stress. So having a routine is the most important thing. And they have lost their peer support often. They're not able to meet with their peers like they did. And so perhaps reinstate some of that, and create a routine. Maybe on Zoom they can then talk to their peers. Definitely going outdoors is very beneficial. And what has happened, I have noticed in the pandemic, is that social anxiety has been exacerbated in some children, and now they really don't want to go outdoors because they've been indoors so long. And that going outdoors needs to be encouraged, not only for all the fresh air and benefits, but social anxiety will get worse if you actually don't interact with people. So some form of interaction is necessary. However, in some children, you might need to talk to your GP or your pediatrician for suggestions and help. Um, then, if it's a very severe case, there are medications as well to help some of these children, and that can be best done under the guidance of your pediatrician or GP.
Thank you, Dr. Soman, for such valuable information. Are there any resources, or I'm sure there are resources, what kind of resources, and where can parents go to access those resources to help their children?
One resource that I would love to mention has been created by SickKids, and this is in the site About Kids Health, and you can access it through YouTube. There's a variety of videos that have been created for the use of children to help them with guided meditation, or to understand what's happening inside in their thoughts, that how to accept who they are, and helping with empathy. So it's a great resource that I highly recommend children and families take a look at, and maybe you'll find that useful.
Being with all of your experiences. A full and meaningful life comes with a range of emotions and physical sensations: happiness, excitement, strength, but also fear, disappointment, and pain. Like most people, you might prefer to avoid unwanted thoughts, feelings, and physical sensations, especially if they are intense or overwhelming. Imagine your unwanted feelings as a beach ball that doesn't go away. You might try different things to pretend the ball doesn't exist. But when you throw it away, it bounces back. And when you move away from it, it follows you. Maybe you try to get rid of this beach ball by pushing it underwater. You manage to keep it out of sight, but if you let go, the beach ball shoots right back up to the surface. So you decide to keep holding the beach ball underwater. It's a lot of hard work. Think about how much energy it takes to keep the ball down, and what you might be missing without realizing it. What would happen if you let the beach ball just be there? Or maybe even tried sitting with the beach ball for a while. Instead of actively ignoring the ball or pushing it underwater, what if you chose to direct your energy instead towards activities and people that are important to you, whether the ball is there or not? Allowing unwanted thoughts, feelings, or physical sensations to be there doesn't mean you have to like them. It means that you are choosing to devote your energy towards the people and things that are important to you. Say your friends want to play a game, but you're feeling anxious or have pain in your stomach. Maybe you can't play the full game with your friends, but you can still keep score or cheer them on. Sometimes it's fun to just be around your friends, even if you can't participate. Some unwanted thoughts, feelings, and physical sensations may never fully go away, but you don't have to devote your energy to suppressing or avoiding them. You can still be involved in activities, even if you need to pace yourself or take breaks now and then. Unwanted experiences are part of life for all of us, no matter who we are. It might take some effort and creativity, but even the smallest steps towards allowing your unwanted emotions and physical sensations to just be there can help you do the things that matter to you and let you live a fuller and more meaningful life.
Thank you so much, Dr. Soman, for being here, for providing us with guidance during these very difficult times and very uncertain times. And as you said, that we ourselves have to bring that routine in our lives, though situation is very different during this time, but we have to try the best what we can during this in the circumstances. Thank you very much once again.
Thank you so much for inviting me.
Thank you, viewers, for being with us and supporting this initiative. We will continue to walk on this journey and we'll be speaking with experts on various issues. Till then, namaskar.